Alright guys and girls, this is jerninhgam here. Ladies and gentlemen, people of the world. Police say 4 men have been arrested in connections with an investigation into a video which appeared to show anti-Semitic abuse being shotted from a car in London have been bolded. So basically, I mean by the abuses, there was a thing in London about that, what's it called, the flags thing of the other country, that they were flowing flags around and shouting discrimination and racist comments and stuff. That's what it's sort of saying in North London, where that flag by Israel. So that's what it's talking about on this video, and this is what I'm going to be showing you again. So I'm going to be rewinding this video again and showing you. Obviously the internet's crashed, and I'm speaking about this. I mean, no one deserves to be talked down on, spat on, abused, hated on. But some people don't have a brain, and some people don't think in the world about other people's feelings. So I thought it'd be interesting to do another video and show you guys and girls and ladies and gentlemen what's been going on about the Israel protest and Palestinian. That's why there were people shouting outside these cars in London. Obviously they've got arrested for what they've been saying. I don't know if they've been saying horrible words, being, you know, just nasty in general. I don't know, but I'm going to try and find the news what I was just talking about until the PlayStation decided to freeze on me. And I was talking about it, so we're going to go back to the beginning. As we can see, we're going to be doing the coronavirus numbers in a minute. No one deserves to get hated on and have cyberbullying and crime. We all make mistakes in this world. I'm going to be trying to find this video. I'm sorry if my thing decided to crash, which it did. Very annoying. It's talking about Tony Blair as well. So basically, this is Tony Blair talking about.
If you get variants,
we're going to talk about Tony Blair.
Types of COVID disease that arise in different parts of the world, the risk is that they then come back into our own country. And you can see this
Where's
with the Indian variant now. So the important thing
lost my bloody
is at the
remote.
same time as we're vaccinating our own people.
Hold on a second, I've lost my remote. Right, so where's my remote gone? Sorry about that, I lost my remote. As I was talking about the Indian variant, Tony Blair's talking about it, so he's giving his opinion about it, and we're talking about these people that have got arrested for Israel and Palestinian things in London. 4 men. You know, if you're going to be silly and talking about silly things, this is what happens.
And a detailed plan for the international community to make sure we're maximising production and distribution to all parts of the world.
More injections.
So that in those parts of the world that are the poorest and where they don't have enough vaccine at present, we vaccinate at least the most vulnerable, the key workers, and the big urban populations, because that will stop the spread of the virus to other parts of the world. The governments are the only ones that can coordinate.
This is in India.
Increase the vaccination production. So, for example, it's important to make sure that some of the production of vaccine at the moment, there's vaccine being produced for other types of condition, that we're repurposing some of that, and that really requires government to help negotiate that with the big pharma companies.
The goal is Health Security Commissioner has set out for planned vaccinating the world in 2021.
Because, for example, at the moment in Africa, you've got about 1.2 billion people. You've got roughly, I'm afraid, at the moment, just over 30 million doses of vaccine delivered to the entire continent. We need to make sure that we're getting more vaccine to the African continent by maximising the supply of vaccine. But the additional problem you have is that of that over 30 million, only a small part of it has yet been actually used for the population. So you also need to work with governments so that they're able to absorb the vaccine they're being given and vaccinate their population effectively.
There we go. That was Tony Blair's speech and how we felt about the vaccinations. As we're going to go back to the one we were just talking about estimated the UK employment rating to be at 4.8 between January and March. And you may hear some noise in the background because I'm watching the news as we're talking. I don't know what the weather's like today, but they were talking about these variants as well.
As to the other areas with the Indian variant. So
around 100,000 extra vaccines a day are being made available,
like Blackburn and
brought
Bolton
to
will have an impact
Bolton and Blackburn,
with the
Indian
spread
variant.
of the Indian variant. But what they're hoping is that they can manage it by getting jabs to more people, and particularly those at a younger age as well. The Director of Public Health pleading with the government to ensure that areas like Blackburn don't have local restrictions. They don't want that because of the impact it would have on businesses, on the hospitality sector. Once again, instead, they just want more vaccines delivered here so they can jab more people.
Okay,
Abuse shouted, you can see.
Well, Downing Street says the spread of the Indian variant could pose a threat to plans to ease all remaining lockdown measures next month. From today, anyone over, I think it's actually 36, can get vaccinated. And the minister telling us earlier on they want to bring that down quite quickly, so it may well be 35 tomorrow. Let's talk to the President of Epidemiology at the Royal Society of Medicine and a member of the Independent SAGE Advisory Committee, Gabriel Scally, who joins us now. Good to see you this morning. Look, in terms of where we're seeing these pockets of Indian variant, what do you think is the best way to try to tackle that?
I think, and at the moment,
this is in Bristol Live, UK.
There are a lot of them, 86 with 5 or more cases, but some of them, they're not all the same size. And in the areas like Bolton or Blackburn, where there are significant numbers, we really should be throwing the kitchen sink at this to try.
The government says here has warned about 86 locations across the country confirmed cases of Indian variant. So look, as you can see here, I'm pointing my finger, it's obviously spreaded across more places in the UK, probably Scotland, Northern Ireland, Wales, probably France and Germany, but they get it. There's some parts of America got the Indian variant. Most probably, but we can sort of see where it is. This is Bristol, UK, for you guys and girls and ladies and gentlemen from there. But anyway, we're going to be talking a bit more about this news. So what we're going to do.
Try and get it down, and that means the vaccination, and it's great that at last they've been given permission to vaccinate people from 18 and over. That's fantastic, and that'll make a big difference. But there are lots of other things. Really good contact tracing and finding of cases and support for people to self-isolate to stop the spread is really important. And for some reason that is not really explained until now, England hasn't been testing people at highest risk. It hasn't been testing all of the close contacts, but rather waiting for them to develop symptoms before offering them testing. So that testing, really good test and trace for a change, is really what we need. As well as that, we do need a lot of vigilance and a lot of information to the public so that they understand that the virus hasn't gone away, it's still there, and it may be much, much more infectious. We also need to stop the importation of it, and that means better border controls, a proper quarantine system. We've been let down badly by the large number of cases that the UK has imported of this dangerous variant that was first identified in India. So there are a string of things that could be done and need to be done.
Okay, look, you raise a whole host of issues there. Firstly, can we talk about the vaccinations then? Because I mean, quite what is happening in these areas with surge vaccinations seems to be unclear. I mean, it's certainly not sanctioned by the government. I mean, the ministers are not saying that they're approving this. So who is approving this, and can it be done in more areas?
Well, what is happening is that the local directors of public health are taking control. They haven't been given the power previously. They haven't been given the resources to do their job. And that's why some of these communities have found themselves in consistent lockdown or consistent restriction. And the directors of public health, I think, have lost their patience, and they're starting to make the decisions. And they should be empowered to make these decisions, and they should be given the resources to do what's needed. You cannot run this pandemic from Whitehall. If we've learned something over the last year, it is that. We need local response, and it needs good local public health action.
Oh, God.
Decision making, and that's what we're starting to get.
Okay, and then from a national perspective, I mean, England for this particular example, if it is necessary to try to stop this, say, highly transmissible variant from becoming dominant across England and then the UK, a local lockdown, something which, I mean, although regrettable, you would support?
Well, I think certainly local restrictions to get it under control, but hopefully we will be doing much more than just putting on restrictions. Sometimes it seems we're like a one-trick pony. The only thing we know is shutting things down, and that's bad for people's health, it's bad for the economy, and it's a bad way to tackle an infectious disease. We do need outbreak control, and that's a whole range of measures, and that includes simple things like improving the ventilation, actually putting some resources into paying for better ventilation in our schools, in our workplaces, ensuring people have fresh air and can stay safe. There's a whole lot could be done at a local level if they're given the power and the resources.
I mean, isn't there an argument to say local restrictions plus surge vaccination at this time could actually, 3 weeks down the line, could have a huge impact, couldn't it?
It could have a large impact, and this is sort of classic public health response to an outbreak and an upsurge, and we better get used to it, because we're going to, whatever we think, we are going to experience outbreaks and upsurges of COVID-19 going forward, and we need to get prepared, and we should look at this as something that's going to have to be done maybe for months to come whenever we get these outbreaks or surges.
Look, we're almost out of time. Can I ask you about the travel situation? You said more needed to be done to stop things like the Indian variant coming in, but I mean, does that raise concerns for you for all international travel being opened up, even in the limited way that it has been so far?
Well, great concerns about this particular variant because of its much more transmissible characteristics. And it hasn't really taken off in Europe yet. And if it takes off in Europe, I think we're in for a very rocky time because, of course, vaccination levels are not at the same high level as they are in the UK, in much of Europe. And at the same time, we're reducing travel restrictions, and many more people are disappearing off on holidays and will come back and not necessarily have any really managed quarantine. And we know self-isolation doesn't work. And I'm really worried about a big wave in Europe if this very transmissible variant or another one that comes along can take off. So a good quarantine system on our borders is absolutely essential.
Gabrielle Scally, good to see you. Thank you. Well,
there we are.
Talking about getting away, a lot of British tourists have tried to get away from concerns about coronavirus by flying off for a quarantine-free holiday in Portugal. Exactly what Mr. Scally says we shouldn't be doing. Let's talk to our Europe correspondent, Michelle Clifford, who's in the Algarve. And look, there are concerns, Michelle, obviously, but we can absolutely understand why people are desperate to get away, and countries like Portugal are desperate to have us.
Yeah, and you could tell that yesterday. I mean, there was real excitement right across the Algarve. We're in the Marina Vila Moura. This resort
FARO, Portugal.
British tourists.
British tourists now allowed to enter Portugal, which is in on the green list.
Arriving at the airport was delighted to be here
Lifting lockdown.
Of so long, and obviously the people working in hotels and bars and restaurants were delighted to see them. They've had really tough times here over the last few months. But I should stress, people are being told they need to comply with COVID rules. Actually, the president of Algarve Tourism was at the airport yesterday to greet some of the UK travellers, and boxes were being given to each tourist arriving. Inside the boxes was a mask, alcohol gel, instructions on what you have to do locally. There are rules in place, social distancing, you have to wear masks in certain areas, and if you're coming to the Algarve expecting what is traditional all-night partying, staying in the bars and the restaurants until the early hours, that isn't happening. Bars and restaurants have to shut at 10:30, but the tourists who came said they don't mind that. They just want a bit of sun. They want a break after such a long year in terms of the COVID pandemic. But there is no doubt here that people are incredibly relieved. The British market is absolutely vital here in the Algarve. You know, people have lost their jobs. Businesses have closed or are only now reopening. They're not back to full capacity, but what they're hoping is that as the summer progresses, more and more British tourists will arrive. And obviously, the fact that they don't have to quarantine on going home is a big factor for many of those choosing to travel.
Yeah, absolutely, Michelle. Thank you. Now, the latest unemployment figures for the 3 months to March have been released in the last hour. Let's find out what they are. Our business correspondent Paul Kelso, 4.8%, Paul. I mean, is that good, bad, or middling?
It's certainly better than it was.
Well, guys and girls, ladies and gentlemen, I'm going to upload this video to YouTube because for a minute, and once it's loaded up, I can make some more videos because I don't want the phones run out of memory space. But anyway, hope you enjoyed the video. Give it a like, give it a comment, share your friends, and I shall see you all in the next video for part 2 of this. Peace.